I'm Robin Castleman, and I'm here today with Dr. Jared Anderson, and he's with the Audiology and Hearing Center, and we're going to answer some of the questions that you guys have called in with. You ready?
Yes. Yeah.
All right. Thank you for being here, by the way.
You're welcome.
Okay, our first caller says, I have ringing in my ears that just started recently. Could this be a sign of hearing loss?
Yes. So the ringing in the ears, commonly referred to as tinnitus, or some people pronounce it tinnitus. It's very commonly a side effect of when the auditory nerves break down, and so the best thing to do would be to follow up for a full comprehensive evaluation to determine what exactly is causing that, and from there the audiologist can talk about the best ways to manage that.
Gotcha. That's a great answer there. My husband started taking an anti-inflammatory prescription last month, and he has noticed that he's having hearing loss. Could this be connected to the medication?
Yes, it could be. A lot of studies have shown that anti-inflammatory medications that are taken for an extended period of time, or depending on the dosage, that can increase risk of hearing loss. The best thing to do would be to follow up with the prescribing physician, let them know of any side effects and symptoms that you're having. If you haven't had a hearing test before, now would be a good time to get one, so you have a good baseline, so your hearing can be tracked throughout the course of that treatment.
Gotcha. Okay. So this person says, I'm an avid cyclist and have considered getting hearing aids, but I don't want something bulky. What would be the best type for me?
Yes. So we have all the different styles of hearing aids. For someone who is very physically active, doing things like cycling, I would recommend one that goes deep in the ear. That's going to cut back on the wind noise. You're not going to have to worry about sweat as much. The strap from the helmet won't be interfering with that, or any sunglasses won't be interfering with that. Some of the selection is going to depend on your hearing loss, and that's something where once we see how you're hearing, then we can talk about the pros and cons of each of the styles that best fit your lifestyle, but also are best going to fit your hearing loss.
Gotcha. Okay. And then the next person says, I've heard that it takes time to get used to hearing aids. How long will that adjustment period be?
Yes. So the adjustment period does vary for each patient. The longer that somebody has had a hearing loss, the longer it takes. Somebody who has a very mild hearing loss that has not been there for that long, they can usually adjust in a couple weeks. Somebody who has a more significant hearing loss that's been untreated for quite a few years, that can take 4 to 6 months or more. We have a very customized approach when we fit patients with hearing aids. So sort of like when you go to a physical therapist, you're going to get a customized, individualized exercise plan. Likewise, we have a very customized follow-up plan to help meet that patient's goals.
So you don't just get them and go, good luck to you. You help them get used
Correct.
to them.
Yes. I tell my patients it's a rehab process, and remind them, give yourself patience. Your brain is hearing sounds it's not used to hearing.
Mm-hmm. And it's like kind of like seeing with glasses for the first time. It's like the trees have individual leaves instead of the hearing is the same kind of thing, right?
Yep. And that's one of the things I love most about my job is hearing those new sounds that patients come back and they're all excited that they can hear again.
Yeah. And then small children, when you can just hear like they hear their mama's voice for the first time or things. Those are just like, feel-good stories.
Their face lights up.
Yeah.
Yes.
Yeah. Well, we appreciate that job that you all do and help us with that. And we come back and answer some more questions sometime?
Absolutely.
Perfect. All right. You guys come back too. And if you want to revisit this segment of Health Experts, log on to WPSD-local6.com and click Health Experts.
All right. Thank you, Robin. Happening today, we want to remind you Mercy Health Lourdes Hospital is partnering up with the American Red Cross to host the annual Community Blood Drive. It's a great opportunity to give blood to those who need it and save lives. The drive runs until 4 this afternoon. It's in the Borders Community Room at Lourdes Hospital. Donors who give blood before this Sunday will receive one of 4 limited edition mystery t-shirts featuring an iconic Red Cross and Peanuts design.
More heat out there today, another 94-degree afternoon, 95 tomorrow. We finally get at least a small rain chance here on Friday. I don't think it's going to be a whole lot, but we'll take what we can get, maybe a few scattered showers. And over the weekend and early next week, we'll continue with at least some small daily chances for some pop-up showers. Nothing to get real excited about. The temperature's still in the upper 80s next week, so waiting patiently for some changes.
Yeah, all right. Thank you, Trent. Thank you for watching Local 6 Midday.